We're talking again about the No ONOO cycle of Martin Pall, and here's his book by Martin Pall, Explaining Unexplained Illnesses. He's a PhD genius, Asperger autism guy. Here's his big paper. It's called the No ONOO cycle as the central cause of heart failure, like a big 50-page paper. And we went through this yesterday. I gave the introduction. I'm going to go through a little bit more detail, some of the individual parts. I'm going to explain how you could treat these patients more effectively, and then that'll be part 2. And then in part 3, I'm going to go through some of the details about the pathophysiology, okay? So this is big stuff. I mean, people are curing heart failure with a vegan diet, and I'm showing why here. Okay, so when you have a lot of inflammation, and let's say you've got elevated transcription factor, nuclear factor, captor B. These inflammatory cytokines like IL-6, tumor necrosis factor, they will stimulate immune cells to make increased inos as well as some other cells. That's going to make an excessive amount of nitric oxide. Now, this is not the good stuff. The good nitric oxide comes from endothelial. That's enos for endothelial nitric oxide synthase. This is inos, inducible nitric oxide synthase. It stays on a prolonged amount of time. This can stay on for minutes and hours rather than just for seconds, okay? So you're going to make tons and tons of inducible nitric oxide. It's a gas, the nitric oxide that's made. Here it is, a nitric oxide gas, and that can diffuse into mitochondria. And especially if there's a large amount of superoxide, it can react with that very quickly to form peroxynitrite. And then peroxynitrite is the central monster, demon, bad thing of the whole cycle, because it just, like I said, it's like AI gone rogue. It'll destroy the mitochondria, destroy the circle pump, destroy the plasma membrane calcium ATPase, and then you get accumulation of calcium in the cell. And then this will cycle back and increase nuclear factor kappa B and have other consequences. Activate NOS and enos. They both go up in the setting of increased intracellular cytoplasm calcium. That's what I meant by it's a vicious cycle. It feeds back on itself and it amplifies itself. So it'll just keep going forever until it kills the cell. So you have to try to break the cycle. All right. So that was the point I wanted to make. Peroxynitrite's right in the center of everything. And there's other ways to feed into this cycle. If you have alcohol, will open up TRP receptors that let calcium into the cell. Excessive pain can open up the TRP cycle. Capsaicin can open up the TRP cycle. There's some other things too. Volatile organic chemicals can open up the TRP receptors. NMDA receptors, that's like the glutamate receptors, that can be opened up with excessive glutamate, okay? It can be opened up with aspartame. It can be opened up with homocysteine. It can be opened up with glyphosate, with beta amyloid protein, okay? All of those things will increase cytoplasm, calcium, ATPase. You get increased calcium. You can open up TRP receptors also from EMF, from your cell phone, okay? Like a lot of people think it's no big deal. They take their cell phone and they put it in their front pocket. I've seen cardiologists do that. It's totally stupid. It's a low-power microwave transmitter. You're putting that right over your heart. Stupid, okay? You're going to be opening up voltage-gated calcium channels on your heart. All right, well, anyways, that's one thing. So what are some of the things you eat more plants, get a lot more antioxidants to deal with all the oxidative stress related to peroxynitrite and the superoxides. That's one thing you could do, okay? There's going to be a lot of things you can do in here, too. We're going to talk about that later, but just getting the ball rolling here. Okay, we also talked a little bit about, the effect of hypertension. Hypertension is going to cause increased work for the left ventricle associated with causing ventricular hypertrophy. The hypertension is also going to keep overstretching the ascending thoracic aorta until it burns out its elastic fibers. You lose the Wien-Kessel effect, and then you're going to have chronic systolic hypertension to compensate for the lack of diastolic flow due to the loss of elastic fibers in your ascending thoracic aorta. The ascending thoracic aorta is like the second heart, the Wien-Kessel effect, okay? And you can't replace those elastic fibers after maturity, after you're in your 20s, so you don't want to trash them. It takes a couple decades of hypertension to trash them, okay? Now, if you ask any doctor, including the doctors like at Harvard, they're not going to know the vast majority on what causes hypertension. They'll say something stupid like, oh, 95% is idiopathic essential hypertension. We all know what idiopathic, it means the doctor's an idiot and the patient's pathetic. Okay, so what's the point? It's obvious what causes high blood pressure. High-fat diets, they're bridging molecules, stick the red blood cells together, overcome the zeta potential. So high-fat is the most important thing. McDougall talks about that. Pritikin talks about that. It's one of the reasons Kempner put the patients on a white rice diet to drop their dietary fat down to 1% of calories from the white rice. Okay. The other thing that causes hypertension is excess dietary sodium. It's a vasoconstrictor, constricts your arteries when you're pumping thick blood from the high fat up to the top of your brain. That's why you have blood pressure. You get blood to the top of your brain. So when you eat the high fat diet, that's going to cause hypertension. But if you vasoconstrict the arteries, you're pumping through a constricted system. Thick blood through a constricted system, that's going to raise it more. Guess what? The opposite of sodium, excessive dietary sodium, is potassium and magnesium. So the good stuff, potassium and magnesium, come from plants. The bad stuff comes from meat and processed food, the sodium and the fat. Low-fat plant foods are exactly what you want. All that potassium, magnesium, and the lack of fat is going to make your blood thinner, lower your blood viscosity. It's going to prevent vasoconstriction. It's going to vasodilate. So that means you'll have a lower blood pressure. So you get less of these heart failure type producing effects. Okay, you won't strain the left ventricle so much. The hypertension itself will deplete tetrahydrobiopterin. You also replenish tetrahydrobiopterin by eating more folate. It comes from foliage, from eating green plants. Okay, nuclear factor kappa B also contributes to these problems. Okay, so what I'm showing you is these are ways to start breaking this cycle. We talked earlier, the plants give you the antioxidants to help fight back against oxidative stress. They give you the folate to fight back against tetrahydrobiopterin depletion. They lower the blood viscosity to prevent hypertension. Okay? You see how you start winning the game? They vasodilate to prevent hypertension. We're breaking the cycle. Evil does not have to win. Good can win. Okay? But you got to know what you're doing, not be an idiot. Okay? And I know a lot of doctors are real smart, but you know what? They don't know anything about nutrition, epidemiology, or toxicology. Okay? And I talked to some. I actually talked to one of the smartest cardiologists you'll ever meet. This is a guy who was in the top of his class. He's authored a textbook. And you know what? He doesn't know the Martin Pall cycle. Okay? He doesn't know this stuff. He doesn't know these case reports by these vegan doctors who've cured CHF. All right? That's because it's not in their literature. It never gets known to them. It never gets told to them, okay? Unless they seek this out on their own. I sought all this stuff out on my own. That's how I learned all this stuff. But I'm trying to let you know, it doesn't matter what cardiologist you go to. The guy I talked to, he's the smartest one you'll ever meet, and he doesn't know it, okay? Because again, like I said, this stuff is all excluded from the conventional medical literature. All right, so, and I'm showing you these are things that I did go over this before. I'm going over it bigger, though, and I'm going to go over a whole bunch of new stuff, all right? But I just wanted to kind of show you up close and personal what this is all about. Here's the other thing, too. There's tons of things that are going to increase calcium coming into that cell. You'd be amazed when you start to study it, how many things are jacking up the calcium in the cytoplasm, which is all bad. You don't want to overstimulate these cells for no reason. We talked about it, beta amyloid protein, your cell phone, in your front pocket like an idiot. Caffeine will do the same thing as psychological stress. Psychological stress will ramp this up as well. Glutamate, MSG, MFG, aspartame, GP in the processed food. Attention deficit meds are like amphetamines for kids. The good stuff you can do, get your son, sleep, social, eat your plants. Your fiber is also going to protect you. It's going to prevent leaky gut. Leaky gut leads to inflammation because the bacterial endotoxins, LTA and LPS, get in there and they cause inflammation. They also cause clotting. They also cause activation in the immune system to increase all these inflammatory cytokines. They're all bad. If you eat the high-fat diet, you get insulin resistance, so you get increased endothelium, vasoconstrictor, bad. You get increased advanced glycation products, bad. So, you know, just like, you know, marijuana is the gateway drug to becoming a drug addict scumbag, okay? High-fat diets leading to obesity, hypertension, and diabetes. They cause all of those things. Then they cause atherosclerosis, and they cause inflammation. Just the high fat will cause your neutrophils to release more myeloperoxidase, and that's a form of inflammation that's damaging to your endothelial glycocalyx, okay? And over time, the diabetes, you're going to glycate your capillary basement membrane, end up with a thick capillary basement membrane. Your hypertension is going to cause vascular smooth muscle hypertrophy and thicken your vessel walls. All of these things are going to have a net effect of leading to less tissue oxygenation. Less tissue oxygenation is going to lead to mitochondrial damage or dysfunction. Okay, and we talk about these are ways to reduce your stress. You know, having a purpose, being stoic, religious, enjoying a laugh when you can, enjoying beautiful things in life, art, music, friendship, social companionship, family, all those things. All right, so anyways, there's a lot of things you can do to fight back against congestive heart failure and these vicious cycles. You know, they seem impossible to fight back for a guy like Martin Pall because he doesn't know nutrition. He doesn't know epidemiology. He doesn't know toxicology, okay? And so that's why it's a big advantage to know these things. They're the most important things to know about making people healthy. Okay, now there I got a blank slide. Okay, here we go. Now we're going to get some new stuff that you ain't seen before. So one of the things that's interesting is normally the heart burns a lot of fatty acids under normal resting conditions, okay? It's very efficient for the heart to burn just some fatty acids, all right? However, when the person is in heart failure, that's typically a major component of heart failure is that they have a lot of mitochondrial dysfunction. Now, I want to ask you, do you see a pattern here? What is the big event in the Warburg effect for causing cancer? Hypoxia, lack of oxygen delivery from the tissues due to high-fat diets and high-sodium diets, and is a big cause of it, and so you get mitochondrial dysfunction. So that's a big thing with cancer. Mitochondrial dysfunction is a big thing with aging. Mitochondrial dysfunction is a big thing with heart failure. So what I'm trying to say is mitochondrial dysfunction is a big thing with diabetes. Diabetes, congestive heart failure, and cancer are very similar in their pathophysiology. Get that? And you might say, oh, isn't that sad? Isn't that bad? But this actually is a form of good news because we know what to do to make mitochondria function better. Low fat, low sodium, whole food, 100% vegan with no oils, no alcohol, no MJ. All right? So here it is, cardiac energy metabolism and heart failure. Congestive heart failure is associated with decreased mitochondrial function and increase in anaerobic glycolysis. So you get an increase in anaerobic glycolysis to help compensate for the lack of mitochondrial function. Just like in a cancer cell, when the mitochondria aren't able to make as much energy, you'll run more anaerobic glycolysis. And you can see this on a PET scan. Look at an FDG glucose PET scan, and you'll see in a congestive heart failure patient a lot more uptake of glucose into the heart. So this is the reason why. So pretty interesting. The heart's pretty efficient. It'll burn primarily fatty acids, but it can burn branched chain amino acids. It can burn ketones. It can burn, the glucose either anaerobically or aerobically. It likes to burn it aerobically under normal conditions, but in the heart failure, it burns more and more of it anaerobically. Okay, lactate can also be converted to pyruvate and burned for energy. So the heart, it needs to keep pumping. It doesn't store much energy, so it has to be able to go, go, go. So it'll burn whatever it can get its hands on. Now here's some interesting stuff. We just talked about a major problem in congestive heart failure and cancer and diabetes and cognitive decline, dementia, is all mitochondrial dysfunction. So you say, well, so what? What is that big deal? I'll tell you why it's a big deal. Because these are all common. Now wait till you see these. Again, I had to look these all up in the medical literature. They're not in all the standard college, grad school biochemistry textbooks. Okay, dietary fat's a major cause of mitochondrial inhibition, let's say a complex 3, especially sat fat. Sort of overwhelms it with electrons and then it starts to back up. Okay, so then you say, well, what's a lot of these patients with coronary artery disease? They're hyperlipidemic, right? High cholesterols. What do they put them on? They put them on a statin. Well, a statin is a coenzyme Q inhibitor. Does that sound smart? Coenzyme Q inhibitor? Okay. Well, of course, lots of these fat type 2 diabetic patients, they got type 2 diabetes. So what do they put them on? They put them on metformin. So that's iatrogenic mitochondrial inhibitors, statins and metformin. A lot of these patients are sad because they're so fat and sick and their life's all messed up. So what do they put them on? Antidepressants, selective serotonin reuptake inhibitors, mitochondria inhibitors. Okay, that's how great modern conventional medicine is. The patient comes in with a problem with their mitochondria, and pretty soon they're on statins, SSRIs, and metformin that inhibit their mitochondria. How about a diuretic like Lasix? That's also a mitochondria inhibitor. Great. And they don't tell them to stop eating omega-6 oils, which get made into toxic aldehydes, hydroxynonenal, which inhibits mitochondria, intermitochondrial membrane, ATP synthase. So that's another mitochondria inhibitor. Okay? They don't tell them to filter their water to get the F- out of there. That's a mitochondrial inhibitor, intermitochondrial membrane. Okay? They don't tell them to get to filter their water also to get the Al out of there. Al, it's in here. Al is also leads to mitochondrial inhibition. Okay? You see how these problems are adding up? If they're eating their turmeric with lead chromate contaminated in the heavy metal, or they're taking protein powders, another supplement that's often contaminated with heavy metals, mitochondria inhibitors. If they're cooking on a no-stick pan, mitochondria inhibitors, PFOA. Okay, if they're in those BPA bottles, mitochondria inhibitor. See how common these things are? A little Tylenol for their pain, mitochondrial inhibitor. Okay, it's pretty bad. All right, and there's a whole bunch more. Well, I'm not going to go into all of them, but you can see if they're on antibiotics, quite often the mitochondrial inhibitors, quinolones, fluoroquinolones, beta-lactam, penicillins, aminoglycosides. These are common antibiotics. And more importantly, let's get back to the processed food. They're eating processed foods, so the processed food is going to have mold inhibitors in their antifungals. They're mitochondrial inhibitors. The glyphosate sprayed on the GMO soy, mitochondrial inhibitor. The atrazine sprayed on the corn, mitochondrial inhibitor. So you can see they can very easily be on 10 mitochondrial inhibitors. Well, gee, don't you think it would be helpful to get them off these mitochondrial inhibitors if you want their cardiac muscle to function better? So this is what I'm trying to say is it's sort of complete ignorance in nutrition and toxicology. They don't know this, and they don't know the side effects of these drugs that well. All right, so like I said, you want to protect your mitochondria? Get rid of the excess dietary fat. Easy to do. Get rid of the processed food and all the mold inhibitors. Easy to do. Get rid of the processed food, the non-organic food. Get rid of the atrazine. You'll get rid of the glyphosate. No oils. You get rid of the omega-6 and the toxic aldehydes. Don't be cooking on these non-stick cookware. You get rid of the PFOAs. Don't be drinking alcohol. It's for chumps. Nothing good comes from it. Fix your cholesterol by, watching your diet instead of taking statins, which inhibit your mitochondria. When you fix your diet and you eat a low-fat vegan diet, your diabetes type 2 will probably go away if you haven't had it that long, and you don't need to take this metformin. Just depends on why you're on the SSRIs, but they don't really work. They're a stupid drug. They cause a slow, progressive lobotomy. So once you fix all this stuff, you probably won't be depressed anymore. You won't need these drugs. Not that you needed them in the first place. That's a topic for another talk. SSRIs are really kind of a joke once you study them. Okay, you don't need Tylenol. F- in tap water. You can filter this stuff out of your water with reverse osmosis. You'll also filter out PCBs, another mitochondrial inhibitor. Don't be taking stimulants for attention deficit. Stupid. Make sure you work with a psychiatrist to come off them, but they're very often, seldom needed. Don't be drinking caffeine. Learn to manage your stress. Get your sleep. Okay, and this is all the things you can do. Okay. Okay, that's the end of part 2. And I'm going to come back then in part 3, and I'm going to start going through the technical details of a lot of the stuff that we just covered. And it's all possible. Like I said, if you eat the low-fat vegan diet, you don't need to be fat, sick, and stupid, okay? The majority of Americans, by the time they're 55, they're already cognitively slow, they're fat, and they're sick, okay? I'm 60. I still weigh what I weighed in high school, 160 pounds, okay? I'm fine. I don't take any medicines. Everything works, okay? That's what you want. And what's the answer? I was fat. I was a fatso for a little while in my 30s because I became a low-fat, low-sodium vegan. That's the key to health. All right, and part 3 coming up in just a moment. We'll talk about more details of all this stuff.